Do you have plantar fasciitis? We can help. Often referred to or known as arch pain, heel pain or heel spur syndrome. Plantar fasciitis is one of the most common and easily treated foot problems. Plantar fasciitis is a painful condition within the foot which causes stabbing, burning pain in the heel area. Many times, people who suffer from plantar fasciitis feel the most pain early in the morning, or after any activity that involves running or jogging. The pain that is felt with plantar fasciitis is due to swelling of a tissue which connects the heel bone to the toes. This tissue, which is called the plantar fascia, is found on the bottom of your foot. Overnight, or during periods of inactivity such as time spent at a desk job, the plantar fascia tissue tightens up, causing pain when a person stands up and mobilizes. This pain is generally reduced as the person moves around. Plantar fasciitis usually affects the connective tissue, the plantar fascia, that runs from the front of the heel bone to the ball of the foot. This strip of tissue helps support the longitudinal arch of the foot. Plantar fasciitis pain usually occurs as soon as weight is applied to the feet after getting out of bed, first thing in the morning, and starts gradually with mild pain at the heel bone. It is more likely to flare up after exercise. You are also at risk if you walk or run for exercise. If you have very flat feet or very high arches, you are also more prone to plantar fasciitis. Signs of plantar fasciitis. 1. Plantar fasciitis can occur in both feet at the same time, but generally occurs only in one foot. 2. Sharp pains in middle of bottom of heel. The pain will feel like stabbing. 3. Worst pain is felt when stepping after lengthy immobility, including after sleep, as well as when stretching the bottom of the foot by tiptoeing or climbing. 4. Pain is felt after exercise, but rarely during exercise, unless bottom of foot is being stretched. 5. A small amount of swelling in the heel. Causes of plantar fasciitis. The pain and inflammation experienced with plantar fasciitis is caused by repetitive tearing of the plantar fascia tissue. Some things which can cause or contribute to this tearing include: 1. Weight gain. 2. Overdoing physical activities, particularly running and climbing. 3. Chronic conditions such as arthritis and diabetes have been shown to increase risks of plantar fasciitis. 4. Walking incorrectly or having an abnormally shaped foot. 5. Wearing shoes without the proper support. Some people are more at risk than others for developing plantar fasciitis. As mentioned above, those with diabetes and arthritis are at risk. Athletes, people who are flat-footed, people who are overweight, and pregnant women are all at higher risk than others. Your job also contributes to your risk factor. If you are a waitress, for example, who is on her feet almost her entire shift, you can be more at risk. Medical care for plantar fasciitis. If you experience any of the signs listed previously for plantar fasciitis, you should seek corrective action, as plantar fasciitis can become more severe as time goes by. Conditions which cause poor circulation can be very dangerous to your feet, and issues with the feet can be severely complicated by these conditions. If you believe that you may have plantar fasciitis, you should not ignore the condition and hope it will go away. Although plantar fasciitis in itself is not generally a very serious condition, if left untreated, it can develop into problems with mobility and issues with other parts of the body. Treating plantar fasciitis. Treatments for this condition range from minimal home therapy to surgical procedures. Some of the most common treatment recommendations for plantar fasciitis include: 1. supports inside your shoe to provide better pressure distribution. 2. Physical therapy and morning stretches. If heel seats and night splints are not eliminating all of the pain. Preventing plantar fasciitis. Although plantar fasciitis is not a life-threatening condition, it can be annoying and troublesome, particularly if it causes you to restrict your level of motion. Therefore, you will want to take preventative measures to keep this condition from developing. Some preventative measures include 1. Stretching legs, ankles, and feet prior to stepping out of bed in the morning. 2. Wear shoes which provide proper support, and try not to wear high heels. 3. If participating in sports, always warm up. 4. Keep in shape and at a healthy weight. Our orthotics recommendation. Any one of our custom orthotics ordered can be modified for plantar fasciitis and heel spur syndrome. Here is what we recommend for plantar fasciitis. Go to drsorthotics.com and look for Orthotics for plantar fasciitis on the left-hand side. RCGF carbon fiber orthotics. Our TL 2100 custom orthotic. Doctor's Orthotics. San Diego, California. Area code 888-353-7834. drsorthotics.com